Hi, I'm Dr. Stan Steindl. Welcome to Compassion in a T-shirt in session with Isabelle Leboeuf. Isabelle is a clinical psychologist in France, where she runs a private practice and also has just completed her PhD exploring compassion and love, as well as positive emotions such as social joy. She has great knowledge and experience around compassion that comes along with a lot of heart, as well as a playfulness and cheeky sense of humour. Please enjoy being in session with my friend Isabelle Leboeuf. Well, welcome, Isabelle Leboeuf, to
Yes.
Compassion in a T-shirt in session. What a joy it is to speak with you all the way over there in France. Now, I remember we met at the Compassionate Mind Foundation conference, and I think it was my first conference, first time to go to that particular conference. Was it for you as well, or?
Yeah, I think we had some exchange by mail before that.
Oh, okay,
Maybe
yeah,
you don't remember. But, can I tell a little story about that?
yeah, yeah, sure,
Or
sure. What is it?
I was just telling a little story on Paul Gilbert's mailing list,
Oh, yeah.
and a story about compassion joy. And you asked me a question about how I would react if something happened in the story. It was about anger. And I was surprised it made an echo because that was something that was questioning me,
Mm,
compassion and anger.
mm,
And I was also surprised because in the way you asked the question, you really paid attention to what I was saying. And I
mm.
thought that was the first time I had the feeling of friendship because it's quite rare to have people who really ask question without trying to say something,
Oh,
really listening.
mm.
And I just wanted to evoke that because I
Oh,
think it's something very important in compassion to be able to listen, and we should talk more about that. I think
oh,
about
yes,
the
yeah.
importance of listening, and of course it's very much you. I think now that I know you a little bit more,
Yeah,
you listen to people a lot. That's what you're doing today, and with
yeah,
this
yeah.
story, I guess.
Ah, oh, thank you, Isabel. I feel very, very moved by that. I sort of get little kind of tingles when you describe that because it's I wasn't expecting that little story there, but yeah, that's really great. I mean, I do feel in many ways that listening is a great act of compassion in a way, isn't it? And where we can try to do that, it can be very helpful. So yeah, thank you. I know that we've continued a little bit of that conversation, not just the anger side of it, but we've over the years corresponded and back and forth a little bit, and of course you have a sort of a big platform on social media as well, and you're involved in the 365 days of compassion kind of community, and sort of really a part of that conversation as well, and on Facebook and other sorts of things. So yeah, we've had yeah, a lot of wonderful conversations, and actually, yeah, I'm hoping to hear more about some of your stuff today. You're doing, a lot of clinical work as well and research. Um, so I wondered, maybe if you could tell us a little bit about what you're up to at the moment, and maybe your work or your life over there, or perhaps even what is it you're passionate about, I guess, in amongst all of that.
I think my obsession. I'm a positively obsessed person. I just focus on positive stuff, and I often focus on compassion and love. And I just finished a research PhD on love and compassion. And I guess I had two motivations. The first one was to try to bring process-based evidence to CFT, compassion-focused therapy, on emotions and attention processes. And my other motivation was a bit more selfish, to have an excuse to think and take time to think about love and compassion and how these motivations work together and how they facilitate or maybe inhibit each other.
That's really interesting. I love how you said, positively obsessed. That's a nice phrase. That idea of really striving, I think, to bring a lot of that, certain positive emotions, positive motivations, various elements of love and joy and other things to compassion. And it's an interesting combo because compassion is a lot about suffering and working with being around, engaging, trying to help suffering. And yet it can often also involve a lot of love and joy and playfulness and really can have a motivation towards flourishing, in all of those kinds of ways. Is it too much to ask to get a little kind of summary of the PhD findings? Like what did you kind of come up with your sort of out of all that research?
Well, thank you for asking. First thing I worked on is on clarifying an emotion I was working with. I worked on compassion imagery from CFT, and I noticed that there was also positive social joy. So I clarified what this emotion is, and I guess what I've been looking at and found is that, as you just said, positive emotions really play a role in regulating the process of compassion in many ways. The first one would be the attention, and a lot of research show that positive emotion open the focus of attention, where threat-based emotion narrow the focus. So I think one thing that CFT does in the imagery work is to facilitate the opening of attention. And of course, positive emotion have been shown to facilitate resilience in many ways. So I try to clarify the role of positive emotions in emotion regulation in the process of compassion in the imagery. And actually, yes, the imagery of compassion does induce positive emotions and reduce negative emotions. I also work on a program of compassion main training
Mhm.
over 1 month. That was we had very good results on social distress and activating compassion.
Yeah, so the positive social joy and positive kind of affect, um, that's really fascinating. It actually is a part of what emerges out of compassion based imagery, I think you're saying, and
Yes.
that there's a kind of a way there that positive emotion then facilitates other mechanisms such as opening up attention, building a sense of strength or resilience, um, regulating other emotions, and sort of it's kind of all in there. The joy or other positive emotions really kind of actually is part of the mechanism perhaps. What are your thoughts there?
I think it's kind of counterintuitive. Most people think of compassion as moving toward negative emotions, of moving towards suffering. So they tend to think about compassion as with associated to negative emotions,
Mm,
where research in neuroscience has shown that it's the difference between empathy and compassion is that compassion also activates positive emotions. Why is it so? It's because it's not just moving toward suffering. It's also imagining, planning that the suffering will be relieved. And from this relief comes joy. When we look at studies, for example, people who are in compassion, they tend to move forward. And this moving forward is associated with positive emotions, not to negative emotions. When you're in threat, you kind of tend to go back, but when you're positive, you go towards. So you need to reconnect hope, and we can even work at it in rescripting imagery. For example, I had a client who had traumatic ideas of someone she had lost in very painful, someone who died in a very painful way. So she wasn't there at the moment, but she kind of had the image of it coming back.
Mm.
And I explained to her the difference between empathy and compassion, and we tried to reconnect images of compassion, like imagining that she could hold the hand of her friend and feeling that he could be relieved from the pain. And just changing a little bit this imagery from the friend in pain to the friend being relieved from pain, he completely switched the imagery, and she was able to be relieved from the flashes and traumatic part of the imagery.
I love what you said before. That's just so inspiring to think about. The suffering will be relieved, and from this comes joy. I mean, that's so beautiful to think of it like that. With empathy, perhaps we are, just really resonating with the suffering, and that's about, in some ways where that stops. But with compassion, it's this anticipation, but that perhaps there will be relief, or some that the suffering will be alleviated or prevented even, and those that kind of anticipation of the motivation there and the outcome, really brings joy. If you think about things from an evolutionary point of view, if there wasn't some kind of joy or positive loop back, in a sense, it might not have evolved, because it would have just been all serious and hard and even painful to be compassionate, and then we would be more likely to sort of avoid. So maybe there's even an evolutionary kind of mechanism there, whereby that joy we feel with being compassionate is part of what then, helps to keep that motivation alive.
It's important to connect our motivation to something positive.
Mm, yeah.
That's why I always try to balance. For example, when I talk about loneliness, if I make a post on Facebook just about loneliness, it's just like nobody reacts, zero like or zero. Just people are just like, oh my God, loneliness, isolation. Oh, I don't want to hear about that.
Ah.
But balance it with also connection and social joy and compassion. That that you can integrate that with hope and
Hmm. And those things help people to engage with it, or help people to feel moved in a way that once they want to approach things. And that's right, isn't it? Because when sometimes we can have that collapse of compassion, where it feels far too much and too heavy, and too much suffering, and too little joy or something, maybe. I mean, I'm just sort of thinking out loud, but yes, it's really it's a very interesting, kind of clarification that you've made there. I can see really that it's a wonderful contribution, and it really helps us to kind of, sort of broaden our understanding of compassion, and just how it might be cultivated, and how it might sort of spread. But so what about you and your journey into, compassion and self-compassion? What's sort of your story there, in terms of how you really got involved in this work?
I think if you go back to this idea of identity, I guess my compassionate identity started even before I was born, because my family is there are a lot of very compassionate women in my family. My mother is a physician. My grandmother was a nurse, and all the women are caregiver. And I have a beautiful mentor, American mentor, who was just president of the American Association of Anesthesiology. And I grew up with these role models of strong women, very compassionate. I guess the tricky thing about having this identity is that sometimes it's harder to receive compassion.
Mm.
It compassion gives a lot of strength, but receiving compassion is a lot more of a vulnerability side of
Mm.
things. And I guess I've been through different moments of depression in my childhood,
Mm.
from very young ages, and also in my teenage age. And I read my first uh, compassion and meditation book when I was 16.
Mm.
I uh, I just randomly bought the book, and it's just completely changed. I started meditation, and I don't know, it made an echo. And I guess being a psychologist is also a path of compassion.
Mm.
And I met Paul Gilbert in 2013 in a French Congress, and I just completely fall in love. I was like, wow, this is great. It resonated a lot with what I was doing, and some things that didn't in CBT was a CBT Congress. There was a few things that didn't really completely match my practice. I guess now that I look back, I guess it's the question of motivation. CBT has put it affective motivation on the side, mainly with Aaron Beck, focus on rational ideas, and that was important because it could put the cognitive biases in light. But at some point, I think today, bringing back compassion and affective motivation is clarifying a lot of things. I think another part of my journey was to do supervision too. One thing that was a bit complicated for me was the receiving compassion. There was a lot of fear associated to that, so I think it was very useful to work on that in supervision. And I realized that also I was not only afraid of receiving compassion, but strangely, I was also afraid of receiving love. And it really helped me to uh, differentiate all that and clarify it. And I was able to expose a little bit more to all this. I think I was afraid, maybe it sounds weird to be afraid of receiving love, but it's not love like open hearted love. It's more what can be associated. I think we often think of love as a positive emotion. If you look in the research, there is also often this confusion. I think what's great with Paul Gilbert's PFT model is that it differentiates motivation and emotions. And
Mm.
I think seeing love as a motivation, not just an emotion, help me to understand that love can be also associated with negative emotions and
Oh,
difficult things like
yeah.
possessivity, jealousy, and even a need of control, a sense of control. And research shows that people in relationship who need to control a lot are also a lot more critical, and that it can lead to difficult things in the relationships.
Mm.
So I think compassion has a lot to bring to understanding the relational processes and help people interact in a more safe and peaceful way.
Mm.
It's always tricky,
Mm.
and it was really interesting for me to do that path to expose myself. And I guess the small changes I've seen from this work is the way I, for example, I look at people in the street. I used to look at my feet in the street before
Mm.
doing all that, and now I can open my attention a lot more, and it's more these little attention things that have changed, and I think I find myself more open and more willing to expose myself. I also made this path to expose myself on social media, and people think I'm comfortable with that, but it was so scary, really.
Yeah.
The first time I put in my picture on my Facebook profile, I was just scared to death. And the first person who put in a comment saying, "Oh, that's pretty picture," I was just, I put this person off and I blocked them. And I was
Oh.
like, "Oh, what is this reaction?" Just,
Oh.
that was my threat system going on and just trying to protect me from being looked at. It was just
Uh-huh.
too scary.
Well, that's
But now I'm comfortable now.
oh, good, good.
I,
Yeah. No, I
I
mean,
got it.
I actually, come from a long line of compassionate women as well. My mother was a GP. Her mother was a GP. Her mother was not a doctor, but was, she sort of went to university and studied, Bachelor of Arts or something. And this is now a long time ago, and so I come from a long line. All my mother's sisters are GPs as well, and so yes, strong, compassionate, women who is sort of, I guess, yeah, I know that feeling of really kind of almost being born into it in a funny sort of a way. I mean, a lot of people are too, I suppose, but yes, that sort of resonated with me, and then it does feel a bit funny to then be a receiver rather than a giver of compassion, doesn't it? Because a lot of that, physicians and nurses and so on, there's a real emphasis there of being compassionate towards others. And so there's an interesting kind of, it's a sort of a double-edged sword in a way. There's a tendency towards self-sacrifice almost even, and
Mm.
so that's always been something for me to kind of be a bit aware of, self-sacrifice, and um, a kind of sort of defectiveness, self-criticism piece. Like there's sort of a bit of both of that. That I think comes out of it. I suppose at one level it looks like generosity and humility, but then at another level it's kind of self-sacrifice and defectiveness. So, well, you've done some very sort of careful work on yourself in all of that, and sort of understanding yourself and noticing those fears, blocks, and resistances, but noticing that they're also there to do with other motivations, love, for example. And it's interesting, isn't it? Because I suppose love flows in three directions too. Love for others, receiving love for oneself, and so being able to differentiate and unpack all of that, and kind of get a sense of the different bits and where you can do some of the work. And a lot of that is about kind of almost just sort of exposure, I suppose, and vulnerability, and just having that kind of strength and courage and wherewithal to just let yourself experience it and open yourself up to compassion from others, or love from others, and just allow it to happen, and to see what happens next. And it literally translates into sort of physical changes. We lift our head and we look around and we notice things, and we start to be, it just sort of, it comes up physically, even as well as all of those other kind of aspects as well. You've had this personal journey in a sense with compassion, and you sort of had this compassionate identity, you discovered CFT, you kind of fell in love with the approach. So how do you now use compassion in your work?
If I make the link with my personal work on my blog with compassion, I realized that it made me more comfortable to work on what we usually call transference and countertransference, to really clarify what is going on in the room, in the therapy room, in echoing maybe the story of the person, or even the evolutionary aspects of the brain and how the motivations get settled.
Mm,
So I think it's really where CFT has helped me the most in the way I feel in the therapy, in working with my own emotions and being aware of what triggers me, and finding really making room also for my own stuff to regulate my own part of the work, where maybe when I was doing only CBT, I was a lot more focused on the patient suffering and how to find solutions to alleviate suffering. And I think it's really a complex dynamic in the therapy room between synchronizing to the patient's suffering, but also sometimes being able to desynchronize, to not get activated by the anxiety or what is playing in the moment for the patient. But that also leads to making space for our own emotional reactions,
mm.
as we're not robots.
Yes. Well, I mean, that's brilliant. I really am fascinated, and I might get you to talk a bit more about the role of CFT and in sort of working with transference. But what your I remember going to a Paul Gilbert complex cases workshop, and one of the things that he said was that complex cases are when there are sort of complex sort of external factors for the client and internal factors for the client and external factors for the clinician or therapist and internal factors for the clinician, that really, like exactly like you said, that complex clinical situations are often a dynamic there between both parties. And so the CFT model, we might be working with our client using that model sort of for them, but it's also there for us in a sense. We're also there using the model, noticing our own threat system, for example, or noticing our own tricky loops in the brain or the mind, and trying to follow that kind of pattern of giving and receiving and those sort of things. Can you talk a bit more about transference or countertransference and how you might work with that from a CFT point of view?
I think an example, it's maybe, I don't know if it's transference, but or transference, but an example of what we're seeing is, for example, when a client has an emotional activation, the more we are synchronized, the more we tend to react emotionally, to feel the sadness or the anxiety in our own body. It's physiological empathy,
Mm,
and bringing awareness, a better awareness to that, it's often very helpful in supervisions. Sometimes I ask the therapists I work with, who is the emotion when you're feeling, for example, powerlessness. Is it your feeling? Do you think there's nothing you can do for this client, or nothing he can do? Or is it his emotion that you're experiencing? And most of the time, they are stuck not because of their own belief that there is nothing to do, but because they are resonating with the helplessness of their depressed client, for example. These processes of empathy and compassion, and really be bringing awareness to where do we synchronize and where there is a need to differentiate, is an important thing, I think.
The thing that sort of springs to my mind in a funny sort of a way is that, often in CFT we might be working with multiplicity or multiple selves, that we work with the client, and perhaps, their anxious self, or their angry self, or maybe their compassionate self. And it just occurred to me listening to you that there's actually a whole bunch more multiple selves in the room as well, and those are our little multiple selves that are also,
Right.
kind of being triggered here and there, and sort of suddenly we might step into a bit of the anxious self ourselves, or we might notice a little bit of critical self, sort of niggling away in the background, or clinician shame is often a thing, isn't it? Just sort of worrying that we're not good enough or doing enough, or things like that. And then, of course, there's our compassionate self as well. But in a way, in any relationship probably, but a therapeutic relationship as well, there's all these different parts, that are there, and that some perhaps emerge from the client, and some emerge from the therapist, and some emerge in the
Right.
therapist but really belong with the client, and like we have all of these different parts, and that
Mm.
ability to kind of differentiate it all, that ability to be able to, oh, let's just sort of notice all these different kind of, players here that are sort of part of the scene, and the differentiation, the slowing down, the finding that serenity. I mean, that's a beautiful word that you said, finding that serenity, that kind of stability and calmness. And then we start to reintegrate again. We bring that all together, and sort of that's where the effective conversation really starts to happen, perhaps.
I think that's what really beautiful with compassion focused therapies, all this chair work and making room for people as the whole. Sometimes people tell me, why should I talk about this part of myself that I don't like? What is the purpose of doing that?
Mm,
And nothing is going to change because we talk about it. And often I tell them, maybe the only reason is for you to be as a whole person here, to be able to talk about all the parts of yourself and feel comfortable with them.
mm,
It, if we think of what is love, maybe love, it could be the definition of love, to be whole with all the parts of ourselves.
yeah.
When we experience trauma or shame, it's kind of cutting a part of ourselves and hiding it. I don't want to hear that. I don't want to see that part of myself.
Mm,
It's too painful, it's too ugly, or too something.
yeah, and sort of working towards becoming whole again.
Hmm.
um,
And I guess supervision and that work for myself also enabled me to bring awareness and make space from some parts of me that didn't fit the ideal idea of a therapist.
mm,
I, 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 I didn't want to be a reactive person or a rejecting person, and I had to work on that and welcome those parts.
mm, mm,
It may not be easy to talk about it for me today. Uh, kind of one more exposure, but it's I really thank you for welcoming that, Stan, and
yeah,
it's really a joy to feel useful and connected and connecting this part of myself and telling myself, oh, it's okay, you can be that person and share it with others, and it's okay.
yeah, yeah. Well, in fact, it's joyful because, even when we might talk with, they quite rightly, they say, why do I have to, sort of think about that awful part of myself, that part of myself that I hate, or whatever. And actually, that is another kind of Paul Gilbert thing, isn't it? That compassion is the courage to descend, into the reality
Mm,
of the human experience. But one of the aspects of that is your notion of joy, that if we are able to approach those parts of ourselves, and we are able to feel somewhat whole again, and less suffering, then it's the joy, it's the joyfulness of sort of, kind of also getting to that piece. Now, you sort of alluded there to I guess, clients, questioning you or pushing back. I mean, do you notice any particular challenges there with clients in terms of how they receive CFT, or whether they show much, kind of challenges with that?
I guess with my clients, my strategy is to start with their emotions and their own experience of compassion. For example, I can ask, at what moment in your life have you been able to help someone, or to I start with recognizing a memory of compassion, and then with small steps, I bring the idea that this might be compassion, that this is what I call compassion. Maybe they don't call that, because in French culture, there's a lot of resistance with the idea of compassion. It's not even understood in the way we could say it in CFT, really.
Mm.
And that's even clearer when I work with my colleagues, when I do public speaking. Often people see compassion on the more sensitive side of it, being present to feel the suffering with. In French, when we translate compassion, it means suffer with. So people have that idea in mind, and they don't see that much that it's taking action and relieving. So there are resistance in using that term. French people prefer to use empathy,
Mm.
but I think it's very useful to discriminate the two of it,
Mm.
although they are very close, of course. Uh,
Mm.
but I almost have more resistance with my colleagues than with my clients.
Yeah. Well,
Often, when I start talking about compassion, they say, "Oh, can I read something about that?" And then I give them books in French, and they come back and they say, "I disagree with this, and I disagree with that." And when they read about it in a more intellectual way, there is a lot of resistance. But when I start with the emotion and the feelings of compassion, there they get it from the inside, and usually there's a lot less resistance from the body, the embodied compassion.
that's really great. That idea of getting it from the inside. I think
Mm.
that's a tweetable tweet, I think, in some ways. Like it's but that nails it, doesn't it? Like the idea is that if we can use memories, or real life examples for them, or we can sort of create a feeling, or a sort of a physiological experience, that people often really kind of engage with it differently when they kind of sort of sense it from the inside. And yet, if we're trying to convince them intellectually about it all, then they just often will try to convince us back, I suppose. And sometimes it's the word, isn't it? Sometimes it's just the word that can create the challenges. And I liked how you said that too, that you sort of said, well, this might not be what you think of as compassion per se, but this is sort of what I'm talking about when I talk about compassion. It's this sort of thing, and then that connects them to it, even if the word for them is not quite right. Now they know what we're talking about. So tell us, like what's next for you? You've actually completed your PhD by the sounds of it, and you've found some interesting stuff, and actually some of your published works and things like that we might include in the detail or the description here on YouTube, just in case people would like to see some of your work. But what's next for you? What do you think?
I think there's two things. One, I'm not sure I should talk about, but just kidding. The first thing is that I'm going to do workshops for the maybe the first time for me, one in French, which will be activating compassion and social joy, and one with Jarin Chu and Chris Father. I'm not good with the pronunciation either.
That's okay. Good, good.
On anger, power, and love. That should be in September. And those two workshops are really exciting.
Yeah.
And the other thing that maybe I should not talk about it, but it's I have this idea of starting to write a book, and I kind of plan. My dream is kind of make this writing a safe place kind of thing, to find a place of silence. Or so I'm right now I'm trying to look for that place, trying to find somewhere where I can hide and just be with myself,
Ah,
and take the excuse of writing to kind of take care of myself and have this.
yeah.
But maybe it's not workable. But I don't know. We'll see.
Well, I think yeah, you've got plenty to share in the form of a book.
You are a very good example, a model for me,
Ah,
writing the compassion gifts, and
yes, yeah, yeah,
I've
yeah.
been waiting for your book for so long, and it's just like it should have arrived like last week, and there's just this mess with the. I'm like,
Um, it hasn't arrived yet.
no, it hasn't. I'm so jealous. But you
Oh,
have it.
I have it in my right. No, no, I think it's a great idea. I mean, it is sort of interesting to put these ideas out there to the world, but but I love that idea of finding a sense of safeness and silence and almost retreat for you, that a place that you can go and be and just be with your thoughts and bring them together and produce this thing. I mean, I think you've absolutely, I don't know if this is what the book would be about, but you've absolutely created your niche there with love and joy and compassion. That sort of, that's a beautiful niche. And I'm very keen to sort of hear more about the workshops. I don't know whether they'll be online.
Yes, the workshop on anger, power, and love will be online,
Great.
and the French one too, but it's in French.
Okay, great.
Can I ask you a question?
Yes.
I'm not sure I'm supposed to, but I noticed before the interview, my brain would keep asking you questions and bringing stuff I wanted to say about you, and I was like, no, Isabelle, this you are supposed to talk about you.
Yes.
So just one question: how did you experience the writing of the book? Emotionally, was it something peaceful or more stressful, or?
No, it was peaceful. It was peaceful. The writing of the book, I did find a place that was also peaceful, and that
Hmm,
was up at Mooloolaba here on the Sunshine Coast, and looking out over the
wow.
water, and a big chunk of it I did over about 3 or 4 weeks in that place. And so that was that I totally feel that this idea of finding a place and really going there with intention to sort
Hmm,
of, yes, bring it down, really connect with oneself and just let it flow without that kind of criticism or trying to judge the writing, but yeah, just letting it flow. I think that's good. The more less peaceful is when the book comes out, because then you're worried about what everyone's going to think. But
hmm.
anyway, it is a very yeah, it feels good. It feels, again, joyful to sort of have that little thing done. Now I'm asking everyone for their 3 tips, because one of the ideas of compassion in a t-shirt is just to kind of have little takeaways for people, little things that they can think about while they're embarking or continuing on their compassionate journey. So I'm sort of, yeah, I'm just curious to hear from everyone and from you, like what would you say would be 3 tips that you would offer people, as they work with compassion?
I guess the first tip that has been a guide for me and very useful as a way out of depression, for example, is we often talk about being here and now, and I would add being here now and where is my attention? What I mean by that is that there are two directions of attention. We can look from ourselves to the world, or we can look from the world toward ourselves. How do people look at me? Do they like me? Do they judge me? How am I seen from the world? And where will the joy come from? That's what we often have, or the direction our attention is often turned to. It's from the outside toward the inside. And if we can just switch that and turn our attention toward the world, and where is my heart taking me? What brings me joy? And what do I see around myself? And just go outside of ourselves with our attention. I think it's really something that is key and that I don't hear very often, and it comes from research on attention processes. It also comes from research on clinical therapeutic strategy for social anxiety. But interestingly, it was already said by Spinoza in the 17th century. He was already explaining that in the Ethic. So I highly recommend reading this. It's a beautiful book.
Mhm.
So that's my first tip. Just turn your attention toward the world. And my second tip would be, when you have this direction of attention, try to move toward the world. I mean, I always send myself challenges uh, to send a message, to move towards someone in the relationships, try to talk to someone maybe that I don't know. And when we do all these little steps, it protects us from feelings of loneliness, and it makes us more connected to others. So I think it's really important to do that. It did it for me. And the third tip I use, and that is helpful for me, is to turn my attention toward out-group people. We've when we are in a social group, there is this kind of circle that's created, and we look at the center of the group. We look at the popular people, at the people who get more attention, and there's this centered attention in groups. And if you don't let your brain do that and you just turn your attention toward people that are on the side, you will find awesome people. Maybe it's the same people outside the group and inside the group, but you will find a very interesting relationships. And there are so many people who are feeling lonely, they don't even know it. And it's really important that we don't focus on people that are in the center and get all the attention, and that we take little steps toward outgroup people. That's where you'll find the best friends you can find.
Thank you. Yes, there's really kind of here now and where is my attention. I agree. I think that's a really invaluable kind of little addition to that notion. And can I turn my attention toward the world? But then the second tip is, okay, now also move toward the world, move, approach, especially around people and others, and sort of that's where we can feel connection. And then thirdly, also be discerning with where or who you move towards, that there will be a part of the brain that will automatically move us in certain directions or to certain places, but kind of be discerning there. And sometimes it might be that you move towards the out group, the people on the side, and that might make all the difference, actually. Well, that's really, really great. Thank you very much for those 3 tips. And if people were wanting to, find you or engage with you, or hear more about your work, where could they do that? Are there any, some of your social media kind of stuff, or other things?
I guess I have a website that is called joycompassion.com.
Mm-hmm.
It's in English, so it's not very, there is a little bit of resources, like guided imagery or a blog. There is a French version that has a lot more content, but for people who eventually speak French, it's joie compassion in French. But I would be very happy to share a book someday, but
Yes, one
we'll do
day.
that if I find my peaceful place, my place of serenity.
Yes, yes. No, you are a bit of a writer already. You write your blogs and various other things, and it's beautiful. It's so, and so they can go to the website, and then from there, can they find your various kind of other contacts and so on?
I guess people could send a mail, but I'm on social media, on Facebook. My Facebook is open, so I would welcome people if they want to join.
Well, I'll include all of those little details on the description, below the video on YouTube. And I'm still getting used to all of this YouTube sort of jargon and so on. But actually, you do have a YouTube channel yourself, so we might actually connect that as well, perhaps, if you're happy to. But
my son would be very happy. He's my coach. He's looking at the YouTube thing.
Yes.
My little son. But
Right.
Thank you, Stan, for the amazing work you're doing. So much time and so much wonderful attention you're giving to people. I just want to thank you very much from my heart.
Oh, thank you, and it is actually, it fills me up. So I thoroughly enjoy it and get an enormous amount out of it myself. And I was so pleased that we could get this time in particular. So thank you for coming on and having a little chat about all things compassion.